Hello, and welcome to the Emergency Department at DMC Sinai-Grace Hospital. I'm Paula Autry, President and CEO of Sinai-Grace. This video will help you through the process of being an emergency patient at Sinai-Grace. We understand that if you had a choice, an emergency room wouldn't be the place you'd want to be right now. But because you're here, I want to reassure you that you are at one of the top hospitals in Michigan for emergency medicine. Sinai-Grace is committed to providing access to world-class care right here in Northwest Detroit. As you look around, you'll see a brand new emergency department. This $77 million investment in our community opened in early 2014. Our private, large treatment rooms give you and your loved ones more space, more comfort, and more privacy. We proudly treat more than 100,000 patients a year in our emergency department, including over 20,000 trauma patients. This means that the emergency department team members taking care of you and your loved ones today are experts in their fields. Our Cardio Team 1 is standing by 24 hours a day, 7 days a week for cardiac emergency and as a certified stroke center. Our team of experts work quickly to save lives and prevent permanent disability. Sinai-Grace Hospital also treats a full range of emergency medical services through the Express Care, which is used for less critical medical situations. Both your Express Care visit and emergency department visit will require your insurance's normal emergency copay because they're billed at the emergency rate. When you first arrive, our registration staff, our registered nurse, will greet you. The triage nurse will determine whether Express Care or emergency care is right for you. Our registration staff will ask for general information, including your name, date of birth, and reason for your visit, so they can generate your patient ID wristband and start your medical chart. Insurance information will be obtained after you have been seen by the doctor. Your health information is protected under the Health Information Portability and Accountability Act, also known as HIPAA. As a part of the Detroit Medical Center, we guarantee a doctor will see you in 29 minutes or less to begin your evaluation and care plan. We try to meet this guarantee 100% of the time, but on occasion, doctors are handling extreme emergencies, creating a slightly longer wait. Patients are seen based on the severity of their illness or injury. This does not mean patients brought in by ambulance are automatically seen quicker. In some instances, patients have been referred to Sinai-Grace's emergency department from an urgent care or their doctor. If you are arriving from an urgent care or your primary care physician's office with a fast pass, please let the nurse or registration desk person know. Throughout your stay, you may see a number of people, including emergency department physicians, resident physicians, medical students, nurses, and technicians. If you are seen by an emergency medicine resident physician or medical student, your care will be primarily managed by a board-certified emergency department physician. Any member of our medical team may take your vital signs, ask you questions, and possibly transport you to other testing areas. Before you are seen by a doctor, a nurse or emergency department technician may draw your blood or start an IV based on your initial assessment. The nursing staff will keep the doctor informed about any changes in your condition. Depending on your illness or injury, tests may be ordered by your doctor. Our medical team will need the results of these tests before they can determine the best course of treatment. Please remember that doing these tests and getting the results requires additional time. Certain tests are affected by what you eat or drink, so please do not eat or drink until your doctor or nurse says it's okay, so we can treat you as quickly as possible. Express Care patients may be asked to wait for results in the Express Care lobby. Then when test results are ready, the staff will take you to a private place to discuss the results and discharge instructions. With your permission, your family may be at the bedside while care is provided and health information is discussed. Please let us know your wishes. as keeping your health information confidential is very important to us. After reviewing your results, the doctor will determine your diagnosis and treatment and decide whether you'll be admitted to the hospital or discharged. If the decision is to admit you to the hospital, we aim to get you to a room within the national goal of 2.5 hours. However, when we have many sick patients in the hospital, the wait for a hospital room can be longer. As we are working hard to get you a room, we will accommodate you in our transitional care unit, which features private rooms and a TV to help make your wait more comfortable. If the decision is to discharge you, a nurse will go over your discharge instructions, which will include how to manage your symptoms, what to expect as you recover, and when you should see your doctor for follow-up care. If you are prescribed any medications, Sinai-Grace has an on-site pharmacy where you may quickly get your prescriptions filled before leaving the hospital. During your emergency department treatment, your family and friends may visit you after your primary workup is done. Because express care visits are usually short in exam rooms with extra seating for one, we ask that you only have one visitor at a time unless you're accompanying a minor. Patients can call their family and friends from the family waiting room areas. Due to HIPAA, we can only give out basic information unless you say it's okay to provide more details. A customer service advocate is available to you and your family. They assist both patient and family upon arrival to the emergency department and provide support during your emergency department experience. Whether your needs are related to comfort measures or answers to questions and concerns, customer service advocates are here to help you. We know a medical emergency can be a scary event. Our team is here to help you through it. You are encouraged to ask the emergency department staff any questions or to clarify the care plan if there is anything that we haven't clearly communicated. If there are any concerns your care team can't answer, feel free to ask to speak to our customer service advocate or the emergency department coordinator at 313-966-7430. Thank you for allowing us to take care of you during your emergency medical needs. We remain committed to being the Sinai-Grace emergency team that is always there for you.